Dog ears. Dog ears, yep. People will get dog ears. Okay. Dog ears, dog ears. Okay. Does everybody know what they are? No, okay. Usually when you close a wound, okay, it's usually a pucker of skin on the end of the wound. So when you close a wound up, you want it to lie nice and flat, okay. When you are operating and you are closing skin, if the two lines of the wound are not equal, okay, so if you have, little drawing here. Yes. If you have a wound like this, no, it's good.
Doggy, that's what they're talking about.
If you have a wound like that, this line here, that's the dog ear. If you have this line here, so this has been cut out, okay? See, that's cut out. So this is one edge of the wound, this is the other edge of the wound, okay? These two lines obviously have to be the same length, so they come together, okay? So they all sit together. Now, usually when you're operating on a chest, if you think about the chest, underneath, you can have a relatively short line across the top here, okay? But then you think underneath, you've got the skin underneath, so you're going to end up with a line like that, okay? So you can see that this line is much longer than that line, okay? And you have to try and get this into there. Well, it won't necessarily work. And usually if that doesn't work, what you sometimes end up with is you get a little bit of a collection at the end here, okay? And that's what's known as the dog ear, beautifully illustrated by Andrew. Okay, okay. So that's part of the reason a dog ear occurs. Now, if the dog ear is purely skin, okay, a lot of it will settle down over time. You can cut that out at the time. You can say, well, okay, I'll extend this up here so that then this matches that in length. Do you see what I mean? Mm-hmm. But the difference with that is your scar has gone from that length to that length. Okay, so you've lengthened the scar. And being a plastic surgeon, we hate long scars, okay? We always try and keep our scars as short as we can, okay? So I don't like extending these unnecessarily to start with, because what will happen over time, with a lot of skin, the skin will contract, it will shrink down, and this dog ear will shrink in size. So it may only end up that big, okay? So you can then go back under a little bit of local anaesthetic, cut that dog ear out, and you have only extended that scar to there as opposed to there, okay? Now, some dog ears will have tissue in them as well, or subcutaneous fat and what have you from out the side here, okay? And sometimes you do have to let that settle and go back and just cut that out as well. Most times you can get it out with under local anaesthetic. It's not a big thing to do. But they can occur. The other thing to think about is a dog ear. So you get one out here laterally, you can get one here in the middle, okay? Now, in the middle here, some people's chests sit apart, some people's chests come very close together here, okay? The last thing that you want to do, or not that you want to do, that I want to do, when I'm coming up to the midline here in the middle, is you don't want these scars to join in the middle, okay? Because if you're doing what I call the low scar, or on the level of the pec muscle insertion, okay, if those join there, you've then got a scar coming from here all the way around to the middle, and you look a bit like a flip top. Okay, it doesn't look good. Okay, it just does not look good. It looks, me personally, I think it looks awful, because you've got this huge scar going from here all the way around to here. If you've got a break in the middle, it's a bit of a trick for the eye and stuff, and we like plastic surgery, like tricks of the eye and stuff and what have you. If you've got a break in it, it doesn't look as big. Okay, so even if this plus this was the same length as that, those do not look anywhere near the same size as that, even though they're the same size. Okay, so that's why we like to try and keep a break here. So that's why if I have a patient who chest comes in quite close here, I think, oh, okay, how are we going to deal with this? Sometimes we will sneak a little incision up this way here, okay, to keep it from coming across the midline there for them. Okay, but usually you will always try. The other thing you can do with this as well is you can take it all out laterally. Okay, so even if you're coming close here, you can sort of take this dog ear, you can sort of push tissue to the side and keep pushing it to the side. So it's all shifting out to the side here, where you've got a little bit of play and you can do really whatever you like with it. Well, I mean, we try and get the chest as flat as we can and stuff. And as I say, I mean, it's a call in the theatre basically and stuff when we're doing it. I mean, if I think I can cut a dog ear out and you know, the scar will be that bit longer, I'll say, oh, okay. If there's going to be something, oh, and it's that extra, it's like, well, not quite sure I really want to do that. I'll take some tissue out from the inside, okay, and then we'll close the scar down and let it settle, and then just see how it settles down and stuff. As I say, the body is very good at healing and fixing a lot of things in itself and stuff. And you can, often a dog ear will turn into just like a little, almost like a little bump in the skin and stuff. Yeah, just a bit of local anaesthetic, and you just zip it out and cut it up and just put a stitch in it and it's gone.